Hi, I'm Dr. Vinton. Welcome. So today I'd like to discuss the 3 errors of medicine. Error number 1. Back then, go back a century or 2. There were no diagnosis, right? There's no diagnostic tools, x-rays, MRIs. There was no real understanding of what health or disease was. If something appeared to be wrong, they did everything they could, including praying to spirits and whatnot, to try to heal the body. Certainly herbs or rest or sunlight and time and prayer were about what we had. So then came the era of modern medicine. What we grew up knowing is error number 2. Error number 2 was the treatment of symptoms, right? So it wasn't about restoring health, wasn't really about looking at causes. It was more based on what is considered evidence-based medicine. So we then had a group of specialists arrive. So we had a doctor for just the stomach and a doctor for just the ears, nose, and throat, and on and on. And so now we're all segmented and we're still treating symptoms for acute crisis intervention. See, but most people now don't get sick of things like they got sick of 200 or 300 years ago, right? Infection. And in fact, the historical research shows us that it was more about stable foods and cleaner sanitation than any medication to help us function and heal and not get sick in the first place. But if you did, antibiotics were certainly a wonderful tool to help that. But here's the problem, and has become the current challenge, which is why era 3 has been coming on for the last 15 years or so and become more mainstream as time goes on. But so era 2 was more about, so let's assume your immune system was weakened and you were sick. So the doctor might prescribe an antibiotic, amoxicillin or something, penicillin, to help fight the germ. The question is, what did they do to raise your body's resistance? Nothing. Much like in today's environment with a joint replacement, right? They go right for the surgery. We use cortisone still, which we've known for over 15 years, accelerates the arthritis. We use a gel shot, even though we know it's meant for a very early stage, but not so good for middle to late stage of osteoarthritis. And then we go right into a joint replacement. Now, again, it's amazing that we can do a joint replacement, but the downside is it's a 50-50. Half do very well and half just simply don't. They still have pain of a 4 to a 6 every day. They can't fully move or extend their joint. They're not allowed to kneel down or climb ladders again. So there are certain deficits that come with that treatment approach. There are certainly things that can be done, and this is what era 3 medicine does. This is what the Vinton method was founded upon. This is what we've been doing for the past 37 years. This is why we've called together groups of physicians of different specialties and surgeons and chiropractors and pain management and neurologists and internal medicine to look at the whole person, not individual pieces, and each one doesn't know what the other one is doing, and each one doesn't look at the whole, because sometimes the simple facts get missed by treating only individual parts and not looking at the whole. By having the best of era 2, but also the best of era 3 medicine, the Vinton method really is the next level of medicine that we'll see more and more of, as we have over the past 30 years. We'll see more and more of it over the next 10 or 15 years until it becomes the new standard in medicine. It's already beginning to change. Patients are already beginning to ask those questions. Sure, we've treated the symptom, but what have we done to raise my vitality? Sure, we've extended maybe my life, but the quality is not that good. How do I improve the quality of my life as well as extend it? So it's the joining of all of those, and it's the phase of personalized medicine. What you might need might be significantly different than somebody else with similar symptoms, because your lifestyle might be different. There might be other factors or ages or whatever is involved. So that's what the Vinton method does. We are truly era 3 medicine, We are ahead of the curve. We are one of the top clinics in the country. Recently, a few years ago, Tony Robbins wrote a book looking at Era 3 medicine, and if you had certain conditions, he went to 50 of the world's leading Nobel Prize winners, researchers, university professors, physicians, and asked, if you had these conditions, what would you do? And then he wrote a book about it. Now, the interesting thing is, I've never met Tony, although I've been reading about his work since I was 15 or 16. But everything in his book we already currently do and have done for over a decade or longer. In addition, there were many levels in his book that they didn't touch on that we've been doing for 20 or 30 years that I'm sure the next book, and if not, we'll write that book, we'll discuss all the basics that they brought about, and down to even the manufacture of the equipment that they're utilizing. We utilize the same thing. So not only is it the best of the best, but then we go 2 or 3 steps deeper and broader than they do. As a result, really, it truly is, we are the best equipped private facility on the planet. We have, we've been here 37 years, but our combined doctors have almost 200 years of experience in helping patients. We've helped over 150,000 patients in those years. And we look forward to helping you. So if you have a health condition that's not responding to what you're currently doing, it's worth a call. If you're looking for increased vitality, it's worth a call. If you're looking to make your final decade or two, not just existing and waiting to the end, but thriving and enjoying life, that's what Era 3 medicine does. That's what we do. So not only can we help you with the crisis that you may currently be in, we can also help you address and correct as much as possible the underlying causes for why you're in that crisis. And by removing the cause, not only do you feel better, you actually become more vital, and you are better avoiding the next round or the next round coming down the pike. And lastly, we like to restore you to a wellness program, which if we practice proper wellness techniques, then we don't have very many problems and we don't end up in very many crises. I'm 59 years old. I take no medication. My blood work is beautiful. My functional fitness tests are beautiful. And as a result, I've been doing this for 37 years, 12 to 16 hours a day, 4 to 7 days a week, depending on which decade of practice and my family I was in. And I'm as vital now and have as much energy now, and I don't get sick. And so what we do is we like to share that with our patients. Now, some people only want Era 2 medicine. They want a more natural way to handle their crisis. They don't really want to deal with what might come next or next. Other folks are interested in not only helping their crisis, but correcting as much of that underlying cause as possible. And still, there's a different group that not only wants that, but they want to return to a wellness program, which had they been following, most likely would not have ended up where they are. And if they want to maximize their final decade or two, see, the statistics tell us that we're living about 9 years longer than we did 100 years ago. The challenge is, we're living 4 years longer than we did 100 years ago. But we're having 9 fewer healthier years. So it's a negative net 5. And we spend those last 5 or 10 years in a steady state of decline, of ill health and reduced quality of life. And sometimes, given the state that a person's in, that may or may not be avoidable. For the vast majority, what we're doing in our 40s will lead to what we're treating in our 50s. And how we're living our life in our 50s will determine what we're treating in our 60s. And there's some really solid research over the last 100 years on how to prevent most of these things from ever coming to fruition. Clinics are jumping on board with bits and pieces. We even saw Cleveland Clinic come on board this year with comprehensive blood work. They said, why wait until you're very ill and spend $30 or $50 or $100,000 on lab work, blood work, trying to figure out what you're sick of? Why don't we do all of those tests on the front end? Far more than your current doctor runs, so we can see what your body's developing and make the corrective changes so that you don't end up with those horrific and often life-changing or life-ending disorders. So that's what it is we do here at the Pain Relief and Wellness Strategy Center. That's what the Vinton method is, a whole person, head-to-toe evaluation, looking at underlying root causes, designing programs to manage and reverse as much of that as possible with frequent evaluations and reevaluations to make sure that things are staying on track. So not only do you feel better, but you actually are better. My own age, technically based on our last set of tests, is 11 years younger than my chronological age. So I'm 59 at this time. But my chronological age, we reversed at 11 years with some very simple lifestyle interventions. So based on my functional test, based on my very elaborate blood tests, not only do I feel fantastic, but inside my body is doing fantastic. See, that's one of the key things. You always go to a funeral and say, gee, that's such a shame. Joe was never sick a day in his life. And there's a difference. No, he may never have expressed a symptom, but that doesn't mean he was well. That just means he didn't express a symptom. And since we know that, unfortunately, 80% of the people with a heart attack, their first symptom of a heart attack isn't chest pain. 50% is just death. God, and the same thing with cancers. 84% don't get massive, symptoms for a prolonged period of time. They have a symptom and then we find out, oh my heavens, it's a stage 3 or God forbid a stage 4. It's the very end stage before you became aware of the first symptom. See, that's era 2 medicine. Era 3 medicine looks at the whole person, looks at a broader range of things so we can determine how are you functioning so that we can then determine what's coming down the pike. It's not a mystery. Where's this train likely to end up? And how do we get out in front and lay down some new tracks so that we can avert that tragedy from happening so that we can add life to your years and years to your life. Thank you.